Hello and welcome to the Comprehensive Tobacco-Free Policy in Worksites webinar. My name is Erin Smith and I've been with the American Lung Association for over 3.5 years. I'm a health promotion specialist and one of my many roles is managing a tobacco grant that services Douglas County. In today's presentation, we will cover all tobacco products, the health effects of tobacco use, the different types of exposure, including secondhand smoke, third-hand smoke, and secondhand aerosol, reasons to consider implementing tobacco-free, nicotine-free environment, implementing a strong, comprehensive tobacco-free, nicotine-free policy, and resources available to help you quit when you're ready. The map on the right shows all local health departments in the state of Nebraska. However, only Buffalo, Douglas, Hall, Lancaster, Lincoln, Panhandle area, Platte, and Colfax, and Sarpy and Cass have tobacco prevention coalitions and receive funding from Tobacco Free Nebraska. One such coalition is the Metro Omaha Tobacco Action Coalition, or MOTAC for short, and it's a dynamic coalition comprised of individuals, organizations, agencies, and businesses. MOTAC formed in 1992 in order to strengthen tobacco prevention and control efforts in the Omaha metro area. Since its inception, MOTAC has led Douglas County in addressing tobacco-related issues through public policy, education, and community action. American Lung Association, Creighton University School of Medicine, Douglas County Health Department, Heartland Family Service, and the University of Nebraska Medical Center's College of Public Health, Center for Reducing Health Disparities, all have come together to make up MOTAC, as well as serve as a community partner for Tobacco Free Nebraska. So underneath this grant, MOTAC serves at the Douglas County, the largest county in the state of Nebraska. Tobacco-free, nicotine-free Worksites is a nationwide and statewide initiative. Tobacco-free nicotine Worksites is a priority initiative of MOTAC, one that the American Lung Association leads. Now let's examine the definitions of tobacco products. A tobacco product is defined as any product made from or derived from tobacco or that contains nicotine that is intended for human consumption or is likely to be consumed, whether smoked, heated, chewed, absorbed, dissolved, inhaled, or ingested by any other means. This is not limited to any component, part, or accessory, cigarette, cigar, pipe, tobacco, chew, snuff, snus, electronic smoking devices, also known as vapes or e-cigarettes. This definition does not extend to nicotine products approved by the FDA for tobacco cessation. Our definitions are comprehensive, which means that all tobacco products that are covered and include all products that have not hit the shelves or market yet. Here are examples of tobacco products. Starting with picture 1 is combustible cigarettes. Picture number 2 is Swisher Sweets Blunts. Picture number 3 is a newer product called Heat Not Burn IQOS. Picture number 4 is a hookah device. Picture 5 is chewing tobacco. Pictures 6 and 7 is snus, loose tobacco that does not require spitting. Picture 8 is flavored cigars. These pictures are dissolvable tobacco products. Dissolvable tobacco products are sticks similar to toothpicks, mints similar to Listerine strips, and orbs similar to Tic Tacs. Dissolvables look similar to everyday candy and mints. So now let's look closer at electronic smoking devices. There are a variety on the market and they contain nicotine, flavorings, and other additives. In addition, these devices mimic the behavior of smoking. All e-cigarettes function by a battery powering the device and a coil heating the solution. They work by heating and vaporizing a solution that contains nicotine. The devices are metal or plastic tubes that contain a cartridge filled with a liquid that is vaporized by a battery-powered heating element. The aerosol is inhaled by the user when they take a draw of the device, just as they would as a regular cigarette. The user exhales the aerosol into the environment. These are types of e-cigarettes. As you can see, they come in a variety of shapes and designs. Here are some pictures of some electronic smoking devices. There have been many reports of these batteries exploding while on the charger or in use, resulting in injury, burns, or even death due to an overheating or malfunctioning battery. From 2015 to 2017, there was an estimated 2,035 e-cigarette battery burn injuries presenting in U.S. hospital emergency departments. Now let's look at the health risks. When tobacco is ignited, many chemicals are released. Approximately 7,000 chemicals are released in combustible process. Here is a list of some of those chemicals. Some of the chemicals are common household items. Smoking tobacco has many health effects. They can be divided into short-term and long-term effects. Starting with the short-term effects, which include shortness of breath, dizziness, excess mucus in the throat, increased heart rate, and increased blood pressure. The long-term effects include lung cancer, lung disease, blindness, cancer of the esophagus, and chest pain. Adults who are exposed to secondhand smoke have a 25 to 30% higher likelihood of developing heart disease, have 20 to 30% higher likelihood of developing lung cancer, have a 20 to 30% higher likelihood of having a stroke. Just as with smoking tobacco, there are many health effects of chewing tobacco. The short-term effects of chewing tobacco are increased heart rate, bad breath, stained and discolored teeth, cavities, decaying teeth, and increased blood pressure. The long-term effects include tooth loss, gum disease, pancreatic cancer, cancer of the esophagus, mouth, tongue, cheek, gum, stomach, and throat cancer, and increased risk of heart attack. The aerosol from e-cigarettes is harmful to the user. We are particularly concerned about the impact of these harmful chemicals on the lungs and the brain. E-cigarettes are a relatively newer product on the market. They emerged on the U.S. market in 2007. You'll often hear from the e-cigarette industry that the two main ingredients in e-cigarettes, propylene glycol and vegetable glycerin, are on the FDA's generally recognized as safe list, but that is only for ingestion, not inhalation. A recent study from the University of North Carolina found that even in small doses, inhaling propylene glycol and vegetable glycerin is likely to expose users to high levels of toxins, and that the more ingredients a user is inhaling, the greater the toxicity. Defective e-cigarette batteries have caused fires and explosions, which have resulted in serious injuries. Acute nicotine exposure can be toxic. Children and adults can be poisoned by swallowing, breathing, or absorbing e-cigarette liquid. Nicotine is not safe. The U.S. Surgeon General has found exposure to nicotine during pregnancy harms the developing fetus and causes lasting consequences for the developing brain and lung function in newborns. Nicotine exposure also affects maternal and fetal health during pregnancy and can result in low birth weights, preterm delivery, and stillbirth. Nicotine also has a negative impact on adolescent brain development. Nicotine during adolescence and young adulthood has been associated with lasting cognitive and behavioral impairments, including effects on working memory and attention. Flavors in e-cigarettes are also a cause of concern. Not only are flavors used to target kids, but they may be harmful on their own. E-cigarette and flavor manufacturers and marketers may suggest that the flavors ingredients used in e-cigarettes are safe because they have been approved for use in food. But such statements are false and misleading since they have not been tested for safety when they are inhaled. Now that we've discussed the effects of tobacco use on health, now let's go over the types of exposure. Secondhand smoke is the smoke produced from burning tobacco products such as cigarettes, cigars, hookah, and pipe tobacco. It is also the smoke that is exhaled or breathed out by the person using the tobacco product. Mainstream smoke is directly inhaled and exhaled by smokers from tobacco products. Side stream smoke is smoke that goes into the air from burning a combustible tobacco product. Secondhand smoke contains over 7,000 chemicals, several of which of them are toxic to our bodies, including 70 chemicals that are known to cause cancer. Non-smokers who are exposed to secondhand smoke breathe in these same dangerous chemicals that the person using the product inhales. Third-hand smoke is the residue and chemicals left on indoor surfaces even after smoking has stopped. Third-hand smoke clings to hair, skin, and such soft surfaces as clothing, bedding, furniture, carpet, drapes, walls, vehicles, dust. Exposure occurs when you touch a contaminated surface or when you breathe in gases produced from the surface. Infants and young children, even pets, are at an increased risk of exposure to third-hand smoke because they are likely to touch a contaminated surface, put that contaminated surface in their mouth, and spend more time on the floor and pull up on furniture. So far in this presentation, I have defined tobacco products, discussed the effects of tobacco use on health, and the types of exposure. The remainder of this presentation will focus on tobacco-free and nicotine-free environments and how to either implement a policy or enhance a policy for your worksite. The American Lung Association has a model policy that I am more than happy to share with you. I also provide free technical assistance that includes assisting you in writing a policy that works best for your business. It is important for a policy to be effective 24/7 because it protects not only employees but everyone from secondhand and third-hand smoke, and it motivates tobacco users to quit. Why not just have a smoke-free policy? A tobacco-free and nicotine-free policy protects everyone from secondhand smoke and secondhand aerosol from electronic smoking devices. A policy also encourages current users to quit instead of switching to another tobacco product. The policy I am talking about today is stronger than the one described by the Nebraska Clean Indoor Air Act. I'm happy to share this information with you. Nebraska Clean Indoor Air Act of 2008 required that all indoor workplaces be smoke-free as of June 1, 2009. The law was recently expanded to include electronic smoking devices, and this went into effect November 14, 2020. The three main reasons to consider to implement a strong, comprehensive, tobacco-free, nicotine-free policy for your worksite include: update existing smoke-free policies, improve the health of employees, visitors, volunteers, interns, and reduce employer costs. I will go over these reasons more in depth in the next few slides. Update existing smoke-free policies. Tobacco-free, nicotine-free policies are a priority because employees that smoke may replace their cigarettes with smokeless tobacco or non-FDA approved nicotine products during times when smoking is prohibited. We have been referring to tobacco-free, nicotine-free policy to be comprehensive to ensure that it includes the latest trend of electronic smoking devices. Tobacco-free, nicotine-free policies protect everyone from secondhand smoke. The second case is to improve the health of employees, contractors, interns, volunteers, vendors, everyone that comes to your work site. These are the current tobacco use rates for adults. These are the current tobacco use rates for youth. These stats are nationwide, but they also portray the picture in Nebraska as well. Smoking is the leading cause of preventable death and disease in Nebraska, the U.S., and worldwide. Nearly 1 out of 5 deaths every year in the U.S. is tobacco-related. Lung cancer is the leading cancer killer in both men and women. Every year, 480,000 Americans die from cigarette smoking, and 2,500 Nebraskans die from an early death from cigarettes. Secondhand smoke kills more than 41,000 people every year. We know that a tobacco-free, nicotine-free policy benefits everyone. It creates a safe and healthy work environment. It demonstrates your worksite cares about the safety and health and well-being of your employees, contractors, interns, volunteers, and visitors. It protects everyone from secondhand and third-hand smoke. A policy motivates tobacco users to quit. The last reason to consider a comprehensive tobacco-free, nicotine-free policy is to reduce employer costs. Approximately $795 million per year is spent on healthcare costs as a direct result of smoking in Nebraska. About $605 million is lost in productivity. Tobacco users cost employers in terms of increased absenteeism, reduced productivity as a result of nicotine addiction, missed work time due to smoking breaks, and increased healthcare expenses. Approximately smokers miss 2.6 more days of work than their non-smoking peers every year. A smoker can start to feel withdrawal symptoms within about 30 minutes of their last cigarette or tobacco use. It is these withdrawal symptoms that can interfere with an employee's ability to effectively perform their job. It is estimated that smokers are about 1% less productive than non-smokers. It's important to note that while every person is different, a study estimated that the average smoker takes 2 15-minute smoke breaks per day in excess of regularly scheduled and allowed breaks. A study estimated that healthcare expenses of a smoker is approximately 8% higher than the expenses for a non-smoker. Smokers are likely to have more insurance claims and could require employers to pay higher premiums. A recent study found that for every smoker that quits, an employer can save between $2,885 and $10,125 annually. For each employee that quits using tobacco, there's an average cost savings of $5,800 annually. The range is approximately between $3,000 and $10,000 annually during the time of employment. These changes can be seen in the following ways: increased productivity, decreased sick days, decreased healthcare costs, and pension benefits. There are many reasons to implement a tobacco-free, nicotine-free policy. Here is a list of benefits that are specific to the employer. I've gone over a few reasons to consider making your worksite tobacco-free and nicotine-free. Upgrade any smoke-free policies, improve the health of your employees, and save you money. If a tobacco-free, nicotine-free worksite policy is right for your business and your employees, it's time to begin the policy implementation process. We now know how a tobacco-free, nicotine-free policy will benefit. However, the big question is how to actually go about implementing a policy change. Well, that is where the American Lung Association comes in. One of the biggest questions is, when should this policy take place and how? Well, it comes down to a few steps and a detailed timeline. That timeline is actually available in this little booklet that you'll have access to. There's a 6-month timeline as well as a 12-month timeline. We can work with each individual worksite to create a specific timeline that works for your needs. The first step is to determine messaging. The next step will be to determine the implementation date. Other steps to consider is health insurance coverage of the cessation product coverage. A significant piece of the implementation process is to provide employee education on what the policy entails and when it will take effect. I can't stress enough how important it is to educate your employees and customers and visitors. This can be accomplished in a variety of ways. Examples include a postcard, a flyer, a mailer to your employees. You can use a variety of methods, including your intranet system. Is a good way to communicate with your employees. Community information is also very important, letting the community know how important this change is. For example, writing an article and submitting that to your local newspaper. Next, you'll need to remove all smoking huts, ashtrays, receptacles, and hang signage. We'd be happy to assist in writing a policy that maintains its integrity, but also fits your business. So to qualify to have metal signage and window clings, the policy must extend to the entire property and vehicle for your business. Again, we serve businesses in Douglas County. If your business falls outside of Douglas County, I will connect you with the appropriate community partner to assist you in your county. What our grant can provide you with is a booklet, assistance with policy implementation, quick resources, and free signage. Some other free resources that we can provide include free technical assistance with policy change, eligibility to receive a marketing piece highlighting the policy change, notification letters to employees and your neighbors, tobacco cessation handouts. Now I'm going to go over the resources available to support quit attempts in the next few slides. The Centers for Disease Control and Prevention, or the CDC for short, has found that 68.8% of adult smokers are interested in quitting. Tobacco cessation programs offered at work sites as part of a comprehensive tobacco-free policy can help tobacco users achieve this goal. So it's important to remember that tobacco users are addicted to nicotine. And this addiction is very difficult to overcome. Sensitivity to the needs of tobacco users is important as you provide resources to help them quit. So here are the cessation options available here in Nebraska. The American Lung Association has a tobacco cessation program called Freedom from Smoking that is available. It offers Clinics provided an in-person group setting for adults and feature a step-by-step plan for quitting smoking. Clinic format encourages participants to work on process and problems for quitting both individually and as part of a group. It's delivered in a small group setting for up to 16 people. Participants receive personalized attention and benefit from reinforcement and camaraderie that they get from peer support. So this is led by a trained and certified facilitator. There are 8 sessions in the clinic which incorporate lectures, group discussion, and skill practice to address a range of learning styles. Research has proven that the more time a smoker spends in a supportive situation, the more likely he or she is to succeed in quitting. In addition to freedom from smoking in-person group support led by a trained facilitator, we have other methods of implementation that is offered to participants who are looking for an alternate program delivery option. So those that want online format, Freedom from Smoking Plus is an innovative behavior change program that's perfect for today's mobile lifestyles. Some features of the program include 9 highly interactive sessions split into 3 phases: getting ready to quit, quit day, and staying smoke-free. So it's available on a desktop, tablet, or smartphone, anytime, anywhere. Fully updated with engaging activities, content, and tools. Includes fully integrated telephone and online chat support from the American Lung Association's expert tobacco cessation counselors at the Lung Helpline. Staffed by registered nurses, respiratory therapists, pharmacists, and certified tobacco treatment specialists, the Lung Helpline is available to anyone looking to start a quit smoking attempt or wanting telephone counseling from an expert over the course of his or her journey to quit. Counseling is available via phone or via online chat or by submitting an email question via lung.org. Counselors are available Monday through Friday, 7 a.m. to 9 p.m. or weekends 9 a.m. to 5 p.m. Central Standard Time. We have bilingual Spanish-speaking staff along with live interpretation service for more than 250 languages. The American Lung Association sponsors the Quit Now Freedom from Smoking online social support community on Inspire platform. Through our online community, members have social outlet to provide warm welcomes and emotional support, making the experience positive and friendly. By sharing stories, patients and caregivers in a community educate, inspire, and empower each other. The Nebraska Tobacco Quit Line is available 24/7. It provides 3 different quit programs. We designed them to meet your style of communication and the support you're seeking as you quit tobacco. All quit programs will help you deal with emotional, behavioral, and physical aspects that make quitting so hard. When you become a member, a team of support coaches, research-based information, and a community of others trying to live tobacco-free. Coaches are available to discuss overcoming common barriers such as dealing with stress, fighting cravings, coping with irritability, and controlling weight gain. So overall, a tobacco-free, nicotine-free policy protects non-smokers from secondhand and third-hand smoke, encourages tobacco users to quit, and creates a positive company image. When implementing a policy, it is important to establish a comprehensive policy, educate employees and visitors, and post signage. If you're interested in moving forward with a policy change, the next step would be to contact us. We would love to meet with you individually and create an action plan that fits your Worksites needs. We're here to help you with every step of the way and make it as easy as possible for you. Thank you for joining me for the webcast today. Please reach out to the American Lung Association for any questions. We can be reached by phone at 402-502-4950 or by email at nebraska@lung.org. Thank you.